Hello everyone, in this video we are going to talk about iontophoresis. Iontophoresis is the transfer of ions of the drugs into the body through the skin by the use of direct constant current. Principles: ions will migrate to the electrode of opposite charge under the influence of an electromotive force. Hyperemia disappears after few hours, but the blood vessels become more sensitive to change from thermal or mechanical stimuli, and hence vasodilatation occurs more easily in the treated area. Apparatus must be providing direct current, power output and milliammeter, dial indicating range, polarity reversal switch, on-off switch. Accessories: electrode made up of aluminum foil or metal, circular in shape. Pads made up of lint, sponge or household clothes. Conducting leads should be firm as well as unbroken. Formula: I into T into ECE is equals to grams of the substance introduced, where I is equals to intensity in ampere, T is equals to time in hours, ECE is equals to electrochemical equivalency. Preparation of electrode fabricated from paper towels, wash clothes or other absorbent materials over which household aluminum foil is superimposed. Aluminum foil should be of several thickness, folded to size, roll flat. Towel should be wrinkle free and soaked in warm water or ionic solution. Electrode should be stabilized by sandbag or straps. Patient position: avoid lying on electrodes. Sitting position for neck, face, shoulder, elbow, head, brachial region, knee. Prone position for trunk, lower back, thigh. Supine position for anterior chest, abdominal procedures. Treatment: selecting the appropriate technique. Before administering iontophoresis, the clinician must first answer the following question: what is the underlying pathology to be treated? What physiologic conditions must be altered? Which ion is known to be effective in this condition? Are there any contraindication to this ion? Is there any alternate ion? What is the most convenient source for this ion? What is the polarity of this ion? What are the electrochemical and electrophysiologic properties of this ion? What placement of electrodes will offer optimum passage of the current? What is the best position for the patient and targeted tissue? What milliampere is suggested for patient's skin sensitivity? What should be the duration of treatment? Treatment steps: dial 0, select direct current, select polarity, massage ionic ointment and place towel, secure electrode placement, increase intensity gradually, treatment time 15 to 20 minutes, decrease intensity gradually, disconnect patient, apply soothing lotion. Follow other modality except whirlpool bath, and shortwave diathermy is excellent choice. Double iontophoresis. Indications: relief of pain. Cathodal galvanism. The counter-irritant effect of the cathodal galvanism produce a marked vasodilatation which, by helping to remove pain factors, is responsible for relief of pain. Anodal galvanism. It is thought to relief of pain by removing the increased concentration of H plus and K plus ions which accumulate in ischemia or inflammation. Adhesion. Ranitidine, which is the derivative of histamine, can be used in iontophoresis. Ranitidine sets up a marked counter-irritation by producing the triple response of histamine. Chronic congestion of mucous membrane. Transfer of zinc sulfate into congested nasal membranes have provided beneficial for the patients suffering from vasomotor rhinitis. Calcium deposits. Acetic acid transfer into calcium deposits is effective. It relieves pain by reducing the size of calcium deposit. Idiopathic hyperhidrosis. Glycopyrronium bromide administered by iontophoresis has been recommended for treatment of excessive sweating. Local anesthesia. Local cutaneous anesthesia is achieved by the iontophoresis of a suitable agent like lidocaine or procaine. Application of antibiotics. Antibiotics can be applied to a vascular area by iontophoresis. Ear chondritis following burn injury has been treated. Chronic infection has been treated by metallic silver iontophoresis. Chronic non-healing ulcer has been treated with xanthinol nicotinate, which is a capillary dilator. Edema reduction. Edema in acute or chronic conditions can be reduced by using hyaluronidase iontophoresis. Hyaluronidase causes increase in the absorption of fluid from both the skin and subcutaneous tissue, thus reducing the edema. Application of anti-inflammatory drugs. This may be used to treat tendinitis and bursitis when delivered by iontophoresis. Neurogenic pain. Iontophoresis of vinca alkaloids is used and recommended appropriate for the treatment of intractable chronic pain syndromes, for example, post-herpetic neuralgia and terminal cancer. Other uses for chronic wound healing: zinc iontophoresis to increase extensibility of scar, iodine and chlorine for fungal skin infection, copper iontophoresis for relief of pain, salicylate. Dangers: shock. It may be because of the following reasons: inadequate earthing of the apparatus, faulty emitter, faulty power point, wet floors, reversing the polarity, increasing and decreasing current too quickly. Burns. Chemical burns can occur because of the following factors: contact of metal with skin, overdose, skin lesions, concentration of current, skin irritation. It is caused due to hypersensitivity to chemicals. It can be prevented by washing the treated part after treatment. Skin sensitivity. It may become reduced due to anesthetizing drugs. Systematic effects may occur due to iontophoresis of anti-cholinergic drugs and histamine-like drugs. Contraindications: open skin. Current tends to concentrate over these points. Large broken areas should be avoided. Small areas can be insulated by the use of Vaseline. Infection. Dangers of spreading infection by the use of direct constant current. Bony areas contraindicated as produce burns. Loss of sensation. It can lead to burn because of overdose. Dry scaly skin. It increases the skin resistance. Skin lesions. Eczema and psoriasis are made worsen by the direct constant current. Pregnancy. It should be avoided in the pelvic areas around the uterus. Drug should be chosen on the basis of pathology. Gouty toffee. Swollen bulbous growth on your joints just under the skin. Lithium is used. Fungi infection. Copper is used. Allergic rhinitis. An allergic response causing itching, watery eyes and sneezing. Copper is used. Open lesion. Zinc is used. Hypo or hypermobility. Decreased or increase in the mobility of the joint. Calcium is used. Scar. A mark on the skin that is caused by a cut that skin has grown over. Chloride, iodine, salicylate is used. Adhesion. It is a band of a scar tissue that joins two surfaces of the body that are usually separated. Chloride, iodine, salicylate is used. Hyperhidrosis. Abnormally excessive sweating involving the extremities, underarm and face, usually unrelated to body temperature or exercise. Tap water is used. Pain. The unpleasant feeling that you have when a part of the body has been hurt or when you are ill. Hydrocortisone, lidocaine, magnesium, salicylate is used. Inflammation. Redness, swelling, pain and a feeling of heat in an area of the body. Hydrocortisone and salicylate is used. Spasm. Muscle spasm is an involuntary contraction of muscle that can cause a great pain. Calcium and magnesium is used. Edema, an abnormal accumulation of fluid in the interstitial space within the tissue, especially in the joints. Iodine, magnesium, salicylate, hyaluronidase is used. Ischemia is a resistance in the blood supply to any tissues, muscle group or organ of the body. Magnesium and iodine is used. Calcific deposits. The deposition of calcium phosphate or other calcific salts at the site. Acetic acid is used.